Magandang araw sa inyong lahat and welcome to another pre-recorded video lecture for the subject M-105 or Comprehensive Family Planning. I am Dr. Leigh Reburon, your instructor. In our previous session, we learned about the different laws that are related to family planning, responsible parenthood, and population control. In this module, we will be studying about the importance of family planning and how it is beneficial to all our clientele, including the mother, the child, and the family. Let's begin learning, shall we? As midwives, you have to remember that family planning is very important in controlling the size of the population and reducing infant mortality. But what are the advantages of family planning for women specifically? Number one is that for some women, pregnancies can be dangerous. Therefore, family planning is vital for them. It helps women avoid any health risks that are related to pregnancy, including the side effects of early or late childbearing, issues connected to poor spacing between births, and even the risk of unsafe abortions. Aside from that, some forms of family planning can also help in preventing sexually transmitted diseases, including HIV and AIDS. And family planning methods can also help women that are already infected with HIV or AIDS to avoid getting pregnant and transmitting the disease to their child. Another benefit of family planning is that it normalizes hormonal levels. Other forms of family planning can normalize the hormone levels in a woman's body. This means that there will be more stable menstrual cycles, less dramatic mood swings, and much clearer skin. This is especially seen on women with polycystic ovarian cysts. Always remember that some pills, contraceptive pills, contain hormones, and these normalizes the hormonal imbalance in the woman's body. So that is another benefit of using family planning. Aside from that, family planning also prevents teenage pregnancies. One of the biggest problems why family planning is important is the fact that it can prevent underage girls from getting pregnant. Girls that give birth in their teenage years have greater risk of harming themselves, their own body, and their baby. Moreover, they often have to abandon their education in order to care for their child, which negatively affects the prospects or the economic standing of such family. So remember that family planning normalizes hormonal levels and they also prevent teenage pregnancies. Aside from the benefits of family planning listed a while ago, family planning can also help to empower women. Family planning allows the woman to decide for themselves whether they want children or not. With family planning, they can control the size of their family and develop more attention to themselves and their loved ones. The women and men get to decide if they want to get pregnant, when they want to get pregnant, and how many times they want to get pregnant because of family planning. Aside from that, family planning also gives women control of their own bodies and their reproductive organs. Some women are forced to stop achieving their dreams or goals once they get pregnant because of their added responsibility of taking care of their children. They stop schooling or sometimes they have to quit their jobs when they get pregnant. Because of family planning, women are given the power to live their own lives the way they want to, and women who opt for family planning can also still pursue education, build careers, and engage in social activities without worrying about their future and their children's future. You also have to remember that raising kids and forming your own family is very stressful, especially if you are not financially or emotionally ready. Life becomes very stressful if one gets pregnant without ample preparation. Which brings us to the next benefit of family planning, wherein family planning can make intimate life less stressful and more enjoyable. What does this mean? A couple can have sex without worrying if their recent contact or coitus can lead to an unplanned pregnancy, which means that the couple can enjoy their sex life together without worrying of any unplanned pregnancies. So, as you can see, there are many benefits of family planning, and it is important that we educate our clients regarding these benefits. Now that you have understood the benefits of family planning in general, let us zero in and focus on the benefits of family planning for the mothers. Always remember that through family planning and proper birth control, mothers are able to give enough time and opportunity to love and provide attention to her husband and her children. She can take care of the members of their family, especially if the number of their family is controlled based on her time and her capacity. Aside from that, through family planning and responsible parenthood, the mother has more time for her own personal advancement. Because of family planning and proper birth spacing, the woman has enough time to put up her own business or probably go back to school or chase a career or do whatever she wants in life. Pero kung siya ay anak ng anak at walang proper birth spacing, she will not be able to attain her personal goals in life. Aside from that, the health of the mother is safeguarded when they use family planning and contraception, especially to those who suffer from illnesses, especially if they get pregnant. A good example of this is a woman who develops pregnancy-induced hypertension, which progresses to eclampsia. We know very well that if that woman gets pregnant again, her life will be at risk or on the line. And if that woman gets accidentally pregnant, her baby or she herself might die. Family planning gives the mother enough time for treatment and for proper recovery. So that is another benefit of family planning. Which brings us back to the next benefit of family planning, which is lowering the risk of dying from complications during pregnancy and childbirth. So those are the benefits of family planning for the mothers. Aside from those benefits mentioned earlier, the mother is also able to breastfeed longer when she properly plans and spaces her pregnancy. We all know that pregnancy can be a commitment and it is very tedious, time and energy consuming, especially for the mother. Supposing a mother is taking care of so many children while she is still breastfeeding her youngest son or daughter, tendency is that that mother will give up breastfeeding in order to take care of the many children that she has. And we all know how important breastfeeding is, especially when it comes to nourishing the child and preventing or reducing the risk of breast and ovarian cancer. Aside from that, when a woman is using family planning methods, the mother is also able to enjoy motherhood better when she, like I said, properly spaces her pregnancy because she gets more time to take care of her baby, her husband, and herself. Aside from that, she can also participate in educational activities or economic and social activities, meaning she can go to work and go travel if she doesn't have many children to take care of. So that is another importance of family planning. Aside from that, if a mother spaces her pregnancy, she gets more time to be physically, emotionally, and financially prepared for her next pregnancy. If she properly spaces or plans her pregnancy, that can happen. And if the woman ever gets to become pregnant again, there will be lesser risk of miscarriage, stillbirth, or preterm delivery. There will also be lower risk of low birth weight because her body was given adequate time to completely heal and recover from her previous pregnancy. So those are added benefits of family planning and birth spacing for the mothers. Now that we have discussed the benefits of family planning for the mothers, how about we also study the effects of proper birth spacing for the children in the family? You always have to remember that healthy mothers produce healthy babies, and with proper birth spacing and family planning, there is lesser chance for the babies to develop congenital problems or malformations or any other problems related or linked to maternal health. Aside from that, because of family planning, the children in the family will get all the attention, security, love, and care that they deserve. This, in turn, will ensure proper physical, emotional, psychological, and mental growth and development of the children if they receive the added or the needed care and attention that they long for. And lastly, these children may also be breastfed for a longer period of time, which will allow them to reap the benefits of breastfeeding, including number one is better nutrition, especially if the child is breastfed longer. Aside from that, they get protected from childhood diseases or illnesses. And lastly, like I said, they get the attention on or bonding or care from the mother. Let's focus on the benefits of family planning for the fathers. You have to remember that raising a child is not just physically and emotionally tiring. It can also be financially exhausting. Family planning lightens the burden and responsibility of the father supporting his family because he gets to decide how many children he gets or wants to support. Aside from that, proper spacing of birth helps the fathers to assume their roles and responsibilities as fathers because family planning enables him to give his children their basic needs like clothing, education, food, and better future because family planning gives him the power to decide how many children he wants to support. Aside from that, family planning of children also gives the fathers more time for his family and his own personal advancement. A father who is taking care of 6 children may work more hours and even take more jobs or side hustles, raraket pa yan pag 6 yung anak na binubuhay niya, comparing to a father who is only taking care of 1 child. So meaning, if you control the number of your family or number of births in your family, then you get to spend more time with your children and your wife. So that is also one benefit of family planning. Aside from that, raising a child can be physically and emotionally and most of all financially tiring. It is a financial commitment. When a father is suffering from an illness, the budget needs of the family is redirected to the budget or the needs of the child. For example, yung tatay ay meron siyang sakit sa puso. Instead of him buying medicines for himself, what he does is he sacrifices his own health. He does not pay for his medicines. He doesn't buy his medicines anymore because the budget is used to take care of the child or provide for the child. So again, when suffering from an illness, when the father uses family planning, he gets more time and more opportunity for treatment and recovery. So that is another benefit for family planning for the fathers. Also, when a father is empowered to plan for their own families, they may feel an increased sense of satisfaction because he knows that he can safeguard the health and well-being of his family and his wife and children. The father may often say, naku, buti na lang nag-family planning ako kasi sigurado kahit ngayong pandemic ay mabubuhay ko yung aking mga anak at pamilya. As opposed to a person who did not do family planning, sasabihin niya, naku, sana nag-family planning ako ngayon, hindi ko na mabubuhay yung aking pamilya dahil sa dami nila. So, as you can see, when you empower the father, they have a feeling of satisfaction. Also, when a father is involved in family planning, he has more time between births to plan the family's finances. The father also gets to decide if he is already ready financially to get another child to support. So kunwari, pag ayaw pa ng tatay na magbuntis yung asawa niya, through family planning, that is possible. Kung gugustuhin ng tatay na magpatayo muna siya ng sarili nilang bahay, or bumili ng tricycle, or mag-put up ng sariling business, that is possible if we assist them to use family planning methods. And lastly, when fathers are actively involved in family planning, they tend to have happier married lives because fathers have more time for their wives and their kids, which will contribute to better relationship between the husband and the wife. Gaya nga ng sabi nila, a happy wife is a happy life. So when there is family planning, the father does not have to work as much or as hard para kumita ng maraming pera, and that means that he has more time to spend with his wife and his family. And the father is also empowered to help the mother in their household chores. Kunwari, nakakatulong na siyang maglinis ng bahay or mag-alaga din ng bata if we empower them to use family planning. Family planning has a lot of benefits for the whole family, but it all boils down to two main benefits. Number one is that family planning ensures that the needs of every individual member of the family are met. Anong ibig sabihin nito? When a couple properly plans the family size and also and only creates a family size that is based on their financial capability, the family is able to ensure that everyone in the family is provided with the things that they need like food, clothing, housing, and education. Pero pag hindi sila nag-family planning at sobrang laki ng kanilang family pero sobrang liit naman ng kanilang kinikita, that means that the members of the family do not receive the basic needs or the physiologic needs that they deserve. Okay? So you have to remember that family planning also helps to attain financial security. Anong ibig sabihin nito? When there is less number of family members, there is also less spending, meaning mas maraming savings yung family. And therefore, they are able to afford to travel, to buy nice things, and also go for better education for their children kung konti yung gastos at maraming savings dahil sa konti lang yung family size. Aside from that, it also reduces the risk of illnesses. Always remember that when a mother gets pregnant very often, we are sacrificing or compromising her own health and even the health of her children. Bakit po? Like I said, when there is an increased number of family members, maraming anak kunwari, the family cannot support them and financially give them the things that they need. Kunwari, yung isang bata nagkasakit, instead of them sending the child to a hospital, ang gagawin nila is magbibigay na lang sila ng mga maligamgam na tubig or traditional medicines na lang so that they will avoid costs or ayaw nilang gumastos. Okay? So that in turn increases the risks of illnesses. But if there is proper family planning, the family is able to afford nutritious foods that will help them eventually prevent illnesses. And lastly, there will also be increased economic participation of the mother. So ibig sabihin nito, kung konti lang yung anak ng nanay at ng tatay, the mother can go back to work and also help in the expenses. Pwede siyang magkaroon din ng sarili niyang trabaho, and in turn, that will also grow the savings of the family. So those are the benefits of family planning for the whole family. A while ago, we just learned about the benefits of family planning for the different members of the family. By now, I am hoping that you already see just how important family planning is to our community and our economy. In this module, we will be tackling about the different roles and responsibilities that a midwife assumes in the dispense of her family planning duties. Hopefully, after this discussion, you will appreciate just how dynamic and adaptable your roles are as midwives and future family planning officers. The first role that we have to assume is the role of the counselor or advisor. Anong ibig sabihin nito? Midwives like us need to provide information and counsel pregnant women and other reproductive couples about their need for family planning, birth spacing, and we also need to help the couple decide on what family planning is appropriate for them, what contraceptive methods are appropriate for their lifestyle. And remember that our keyword here is to help them decide, and we should not impose on our choices to them, and what we do is just we give them advice on the best or most appropriate contraceptive method there is and that is applicable and available for them. Aside from that, as family planning counselors and advisors, we need to increase the number of family planning acceptors and users, and also reduce the number of family planning defaulters in the community. So anong ibig sabihin nito? We need to educate and counsel the people so that they will be more accepting of the family planning and contraceptive methods that we are offering. So how do we do that? We should advise the people in our community and try to talk to them and convince them about the benefits of using family planning and contraceptive methods. And we also have to convince the family planning defaulters or non-users that family planning is safe and effective. So that is one way to increase the number of family planning acceptors and reducing the number of family planning non-users. And lastly, we midwives as counselors and advisors are expected to advise the couple on the development of the birth plan and to promote the concepts of birth preparedness. So tinutulungan nating maging handa yung mga mag-asawa regarding their family size, kung kailan sila magiging pregnant, and other things like that. We also advise them on complicated situations so that it will help them make better decisions in the future. So those are our roles and responsibilities as family planning counselors and advisors. And as midwives, we also need to become good communicators or motivators. What do we mean by this? As communicators, we, the midwives, should understand the effectiveness of communication to inform our clients and the recipients of our family planning and reproductive health services. We need to be good communicators so that we can motivate and encourage them, our clients especially, to use family planning methods. And as good communicators and motivators, we should be very conscious and cautious about the way we speak, the way we act, the tone of our voice, its volume, because somehow or sometimes it's the way we tell the information or we say things to our clients that potentially encourage them to use family planning or potentially drive them away from availing of our services. So anong ibig sabihin nito? As communicators, you have to be very good when it comes to expressing yourself without offending other people. And as communicators, we also need to develop a trusting relationship with our client. Why? Because sometimes reproductive health and other sexual conditions or sexual topics can be very awkward and very difficult to talk about. And sometimes patients might disclose certain information that can be self-deprecating or derogatory. So as midwives, we have to always protect the privacy and confidentiality of our patients, and we should not share this information to other people. This way, we can develop a trusting relationship with our clients, and they will believe in us, and they will also do the things that we tell them to do if we try to protect their privacy, and they know and they feel that we are protecting their sense of confidentiality. And lastly, we have to understand and answer all the reproductive health and family planning related questions of our patients. So as communicators and motivators, we do not just speak and give information to our patients, but we also have to listen to them. We should know what concerns them, what their questions are, so that we can properly give the information that they also need. And when we answer their questions and when we dispel their beliefs or negative connotations about family planning, we are able to educate them and convince more people to use family planning methods. So those are our roles as communicators and motivators of family planning. Midwives are also expected to be good educators. And what are our roles and responsibilities as educators? Number one is that we need to provide high quality, reliable, and culturally sensitive information to our patients. Anong ibig sabihin nito? That as midwives, we need to ensure that what we are teaching our patients are based on sound, reliable, and scientific information. We also need to consider the cultural background or the ethnic roots of that person we are giving information, and make sure that the things that we are teaching them are culturally sensitive and we are paying respect to the culture of that person or to the ethnic background of that person. So that is one role of the educator. And aside from that, we are also expected to educate our patients regarding the benefits, effectiveness, mode of action, the advantages and disadvantages of family planning methods. We have to be very honest to our patients as educators. We midwives are also tasked to inform our clients of the potential side effects and complications and what to do if problems persists when they are using family planning methods. This concept is what we call full disclosure, and we should ensure full disclosure of information regarding family planning. Anong ibig sabihin nito? That we should not oversell the benefits and the advantages of a particular family planning method, and that we should always tell all our clients the potential risk, harm, and disadvantages of the different family planning methods. Bakit natin gustong sabihin din yung mga harm or risk or disadvantage ng mga family planning methods na ito? Always remember that the reason why we are educating our patients regarding the advantages and disadvantages of a specific family planning method is that we want them to make informed choices and paano sila makakagawa ng sarili nilang desisyon kung tinatago naman natin yung mga ibang information sa kanila. So always remember that as educators, we need to do full disclosure of the risks and benefits of the different family planning methods. And lastly, we also need to educate all our clients on reproductive health, their reproductive rights, and other reproductive system-related diseases or conditions. So those are our roles and responsibilities as educators of family planning. As family planning officers, we are also expected to be service providers. And what do we mean by this? We, midwives, are expected to provide packages of health services among reproductive age groups in all health facilities. And we are expected to provide the following services like family planning, maternal and child health services, management of reproductive tract infections, sexually transmitted illnesses or sexually transmitted diseases, management of breast and other reproductive cancers. So those are the things that we are expected to provide services. And lastly, in events wherein kunwari we cannot handle the services or the needs of the clients because it is out of our practice or it is out of our responsibility, we need to find a person or an expert who can better treat the patient through referral system. So those are our roles and responsibilities as service provider, to give packages of health services and also refer our clients if the services that they seek are not part of the services that we offer. And as family planning officers, we are also expected to become service managers, and we need to ensure the availability of supplies and logistics. Anong ibig sabihin nito? That as midwives, we are expected to ensure the availability of family planning supplies and logistics for all of our patients. This means that we need to keep track of our inventory. Dapat nililista natin yan. And make sure that our supplies are regularly replenished. Kunwari, nagamit yung isang box ng condom, papalitan dapat natin yan agad-agad sa ating supply cabinet. It is our job to ensure that family planning supplies are always available and accessible to all of our clients all the time. And aside from keeping a detailed inventory, dapat meron kang listahan of all the family planning supplies that we have. You are also expected to make requests or purchase if a stock is running low. Kunwari, konti na lang yung mga IUD, dapat gumawa ka na ng request to be forwarded to the specific offices. And aside from that, you have to replenish the stocks on a regular basis. So that is one responsibility of the family planning service manager. Aside from that, we also have to record and keep track of the services that we provide to our patients. Anong ibig sabihin nito? We need to update our patient records because it helps to make the continuity of care easier to enable identifying problems in the early stages. Kunwari, you are a midwife and you are taking care of patient A. Now you are transferred to another healthcare facility, or kunwari you are absent. Now, the person or the midwife who will take care of patient A can easily continue your plan of care if and only if you do proper documentation of the services you provide to that patient. So that in the event that you are absent or kunwari transferred ka sa other location, the midwife who will take your place will know what services have been given and know what services are still needed to be given. So those are your responsibilities as service managers. And now that you know the different roles and responsibilities of the midwife as the family planning officer, let us study the different values and character traits that should be possessed by a family planning officer. Always remember that a good family planning officer possesses leadership. And why is leadership necessary? Now, we should offer unique integrated educational training and clinical services in reproductive and sexual health to our patients. And we should always think outside of the box and try to think of new ways on how we can develop or give our services better to our clients. Meaning, we should not be basing on the tradition. Hindi dahil sa ganito yung dating ginagawa namin. Sabi ng isang family planning officer is that you will stick to the tradition. As leaders and family planning officers, you have to be thinkers outside of the box and try to devise new ways on how you can deliver your services to your clientele. So that is a mark of a leader. Aside from that, as a leader, you need to remain equipped with the latest information or data or knowledge on different contraceptive technologies and reproductive and sexual health advancements. As a leader, you should know what is happening in the international arena so that you can also try to share these advancements or developments to other workers in your rural health unit or family planning office. Always remember that a leader is always trying new things or discovering new ways how to improve their services. And staying abreast with technological advancements is one mark of a true leader. Aside from that, a good family planning officer and a leader is also able to take an informed and considered stand on complex social and reproductive issues such as the reproductive health bill. Anong ibig sabihin nito? That if a person comes to you and asks you, what do you think is your opinion regarding the reproductive health bill, ikaw as a good leader and a family planning officer, you are able to tell your stand and tell which side you support because you are properly informed about this matter. So that is a mark of a true family planning leader. Aside from that, you also have to evolve with your skills and with your roles and responsibilities to always adapt to the 21st century clients. Always remember that the needs of the clients way back decades ago are different from the needs of the clients now. And as leaders, we need to be resourceful and we need to understand the different needs of the 21st century clients so that we can also transform ourselves and transform our services so that we can cater to these new clients that we have. And lastly, we have to also lobby and consult other authority figures or people in political power so that we can advise them and we can also gain their trust and confidence so that we can advocate effectively on behalf of our patients for better reproductive health outcomes. Kunwari, you notice that in your community you have an increased number of teenage pregnancies. And when you did your observation, you found out that the curfew in your locality is very lenient. Kunwari, payag pa rin sila na namamasyal yung mga underage children, babae man or lalaki, during the wee hours in the morning. So what do you do as a family planning officer and as a leader is that you have to talk to these individuals, yung mga political leaders natin, to create barangay ordinance or policies that will cater to these problems that we have. So kunwari, padagdagan nyo ng curfew yung lugar nyo to decrease teenage pregnancy. So those are the things that you can do as a family planning and as a leader in your community. A good family planning officer also possesses openness. And what do we mean when we say openness? A midwife should foster an open mind and a non-judgmental attitude and approach when giving services to our clients. Always remember that it is very difficult to speak about our sexual health to other people. And for some, this conversation may come as a taboo. Mahirap siyang pag-usapan. And as midwives and family planning officers, we need to control our emotions and we need to be non-judgmental to our patients and make sure that we are dealing with their problems professionally. So dapat naiintindihan natin yung kanilang sitwasyon and dapat hindi natin sila pinagtatawanan. Which brings us to our next characteristic, which is their ability to provide services without judgment, malice, and prejudice. So what do we mean by this? We have to listen and act according to our code of professional conduct. And we also have to remember that having prejudice and judgment to our clients because of their sexual health practices or reproductive health problems is a no-no when you are a family planning officer. We should not laugh at the situation, and we should also ensure that we are protecting the privacy and confidentiality and also the dignity of our clients. We should listen to their problems and provide appropriate care that they need without us giving them judgment. So dapat pag nagsasabi ka ng advice sa inyong mga pasyente with an open mind, you also have to be empathic of what the patient is feeling. So that is one trait of a family planning officer. Aside from that, we should also provide options and choices to our clients. Always remember that we have to give our clients different choices. And while we are giving them different choices, we have to explain the different advantages and disadvantages of the different options that we are presenting. In cases wherein the patient did not choose the option that you presented, you have to respect their decision. That is your role as a midwife. You have to be open to the many decisions that your patients will present. And you should not impose your choices or your beliefs on these patients. You have to remember that our role is to guide them to go to or to achieve an informed decision. At pag nag-decide na sila, wag mong sabihin na, naku, mali ang decision mo. Wag pong ganon. And a good midwife is open to accepting the choices of their patients. And lastly, you need to find other people who can help the client through referral and linkages. Again, if a patient comes to you and tells you their problem regarding their reproductive health or sexual concerns, and you understand that their problems are not part of your purview, hindi mo siya kayang i-handle, you have to look for people, experts that can properly help them. And you should only disclose the information that were shared to you by the patients if you are talking to an expert who can actually help them. So you only refer them to people who might actually help. So those are the traits that you should possess as a family planning officer who has a sense of openness. And as midwives, you also need to possess a sense of expertise. And paano natin na-attain yung sense of expertise? Number one is you educate yourself all the time. Dapat continuous po yung learning yon, yung professional development nyo by going back to school, getting a master's degree, or attending seminars, training, or workshop, and staying abreast or up to date with the different advancements in reproductive and sexual health. And aside from that, you have to create a multidisciplinary team in your area. And that team should be composed of doctors, nurses, counselors, and midwives so that you can ensure that there is a wide range of stakeholders and clienteles that are given services of your family planning office. So, dapat mag-create ka ng sariling team, and yung mga teams na to should be composed of experts who can actually help our clients. Aside from that, you have to again Be extensive and updated on the knowledge of your reproductive and sexual health by, like I said, going back to school, attending seminars and workshop, and staying up to date with the different advancements in technology and contraceptive methods. And lastly, you should have to make decisions and create activities and plans that are only based on sound evidence and research studies. Huwag po kayong gagawa ng mga projects nyo in your community that are based on internet na hindi naman po valid or reliable yung mga sources. Always remember that we have different memos or different policies that are coming from the Department of Health, and you should only base your activities, your decisions, and your actions on these materials that are provided by reliable sources. And lastly, you have to remain responsive, proactive, and you should work with the highest standards of excellence possible. Like I said a while ago, or like I said all the time, excellence is not a virtue, but it is a habit. Excellence is not just done on a single basis, dapat continuously niya prina-practice nyo yan. So as midwives, when you say you want to have expertise, you have to commit yourself to excellence in service. So those are the things that you need to possess when you want to become a family planning officer who is an expert in their chosen field. As a family planning officer, you also need to create a sense of trust between your clients. So when you establish your relationship with your clients, there is a feeling of trust na pagkakatiwalaan ka ng patient mo. And how do we do that? Number one is that we need to create and provide a safe environment for our clients. Always remember that they will be disclosing certain sensitive information to you. And as a family planning officer, you need to make them feel their sense of privacy and confidentiality and dignity are always protected by always talking to your clients in a safe environment. Kunwari, you lock the doors and you close the windows para hindi nila marinig, hindi marinig ng ibang tao yung pinag-uusapan nyo. And not sharing this information to your workmates is one way to gain the trust of your clients. Aside from that, you only have to provide patients with factual informations. Yun lamang po yung dapat na binibigay natin. Hindi tayo na dapat nagbibigay ng information that are based on hearsays or rumors or yung mga chismis, because if we do this, they will doubt our services that we are providing. So when we are giving information to our patients, dapat our sources should only be reliable and valid and sound and based on research studies. So that is also one way of gaining the trust of our patients. And when you are giving information to your clients, you need to give them gender and cultural and social sensitive information. Anong ibig sabihin nito? That when you know that if a certain information can potentially hurt a patient, kunwari it's not part of their cultural belief, wag mo na dapat siyang sinasabi sa kanya. That is how you gain the trust of your patients, by making sure that you are cautious when it comes to their gender, their cultural preferences, and the social implications of what you say. So dapat you have to be very sensitive about the feelings of your clientele so that you can gain their trust. And like I said, you have to be very honest to your patient, and you should always give them full disclosure of the advantages and the disadvantages and the risk of the certain family planning method that you are presenting to them. So para maiwasan yung mga sinasabi nila na ikaw kasi hindi mo sinasabi na ganito pala yung effect ng ganitong family planning method. Para maiwasan yung mga bagay na yun, you have to observe full disclosure. And you also have to be responsive to the reproductive and sexual health needs of a person. Kunwari, you notice that a mother is already has 7 children, it is not bad if you tell them na, mother, punta ka sa office natin, mag-usap po tayo so that I can tell you the benefits of family planning method. So hindi po masama na sinasabi natin yon. Remember that it's not about what you say, but it is how you say it that really matters. So when you see a person that kunwari has reproductive problems, you try to deduce information from them, and you also try to offer help to them. by being responsive to the sexual health needs of the people you meet. And lastly, you have to provide advice and opinion to the people in authority regarding the reproductive health issues that are concerning our community. So dapat may tulungan po regarding the people in power or the people in the political figure, kunwari yung mga mayors natin, vice mayor, Sangguniang Bayan members, dapat kinakausap natin sila. And we talk about the observations that we have regarding the reproductive health and sexual health issues that we encounter in our locality so that they can create policies, that can curtail these problems. And that is also one way of creating trust, not just to our clients, but also to the people in authority. So dapat yun yung mga ginagawa natin as midwives if we want to become very good family planning officers. Another character trait that a good family planning officer should possess is the sense of passion. When we talk about passion, it means working with commitment, drive, and dedication. And patients should also feel that you genuinely care about their health and reproductive health concerns. So dapat pag nagsasalita kayo sa kanila, you should be talking with a sense of empathy and dapat nafe-feel nila na talagang concerned kayo sa kanila so that they will follow your advice. Aside from that, you also have to be flexible and you have to be willing to adjust to meet the needs of the individual client. Kunwari, a patient is scheduled to meet with you on a Monday. And sinabi niya, ma'am, hindi po ako makakapunta on a Monday kasi po meron akong problema, meron akong kailangan na puntahan, meron akong pasok na trabaho. And as midwife who is working with passion, you have to know how to be flexible and you have to adjust your schedule so that you can also entertain these kinds of clients. Always remember po, no, that the patients can really feel how much we care about them. And one way of showing that we care about their health is when we try to give them flexible options regarding their consultations with us. Okay? And lastly, we also need to find solutions to certain problems by staying resourceful as much as possible. So kunwari may sinabi silang problema sa'yo concerning their reproductive and sexual health and you cannot address these sexual concerns because it is not part of your purview or expertise, you have to remain resourceful. Hindi dahil sa hindi mo siya responsibility, sinasabi niyo, bahala ka na sa buhay mo. Hindi po pwede yon. As a good midwife and as a good family planning officer working with passion, you have to be resourceful and stay innovative when it comes to solving the problems of our clients. So dito po pumapasok again yung ating referral system. When we look for experts that we can help our clients with their problems, that is working also with passion. So tandaan nyo po yun palagi. And the last character trait that a midwife should possess is her sense of community. That means that the midwife should empower the communities and all the individuals with whom she works with. Dapat she stays committed in working with the community. And she also has to remember that she is not just working with individual clients or couples. Dapat she should also look into the community and take that community as her own patient. Okay? So she should be committed in serving the whole community. And she should also be sensitive in diversity. And we talk about when we talk about diversity, we mean the different clients that we have. Dapat po yung mga services na provide natin sa ating community is not a one size fits all. Hindi dahil sa sinabi mo ito kay client A, yun na din yung gagawin mo kay client B. Hindi po ganun yon. You have to create a tailor-made approach to all the individual concerns of your patients. That is what we mean when we have a sense of community and we respect the sense of diversity. Dapat, kada ibang tao, iba din yung approach natin that is tailor-made to really address the problem of that specific person. Aside from that, we should also help all people to have access to the reproductive health services that we provide. Hindi porket hindi siya kakampi ni kapitan or hindi siya kakampi ni mayor, ay hindi na natin sila binibigyan ng mga family planning or reproductive health services natin. always remember that our dedication and our loyalty should not fall on the people in power but should always fall in the community people. Yun dapat yung ating sense of community, that we should provide service that is inclusive and accepting of all people regardless of their race, their age, their political affiliation, their religion and cultural background. Dapat lahat-lahat po sila ay ating binibigyan ng culturally sensitive services in our family planning office. And lastly, we should also respect the special needs of different clientele. Like I said a while ago, our community is filled with diverse population. May mga tao dyan who have different gender preferences. May mga PWD or people living with disabilities. May mga iba't ibang mga preferences yung mga tao. And as family planning officers with a good sense of community, we should also make sure that our services are inclusive. They are embracing these kinds of people with different needs. That is how we promulgate the sense of community as family planning officers. We should dedicate ourselves to the greatest good to the greatest number of people. So that is your role as a family planning officer with a sense of community. And that concludes our pre-recorded video lecture. Maraming salamat for listening at nawa ay marami kayong natutunan sa akin. Always remember to log on to your Edmodo account, your Facebook chat rooms, and your Google Classroom so that you can access the link that I will be sending for your next quiz. Muli, stay safe, observe physical distancing, always wear your face shield and face mask, and God bless. I'll see you guys next time. Bye-bye.